Hello everyone, happy to see all of you in this meeting and welcome back to today's session organized by VODAN Africa and Asia. My name is Putu Hadi. Our focus today is to discuss on VODAN Africa and Asia update. Start from the demo update from Professor Francisca and also demo from Getu and Samson and CEDAR and also access and control update. And the last session is to discuss about the article fair special journal update. As always, try to keep our mic muted and during presentation and to prevent background noises. If you have any question while the presentation is going on, please type them into the chat box. And so I will now hand over to Professor Francisca to lead the session. The floor is yours, Professor Francisca.
Thank you, Putu, and special thanks to you and Aliyah for always putting this together every week. Thank you. Welcome, everyone, and thank you for making it to today's webinar. Like Putu already said, I'm going to be giving a kind of a brief update on the activities within the last 1 week. And after that, we'll get an update from Aliyah and possibly Miriam on our project on the CEDAR localization. And then we have Samson and Getu. They have made some improvement on one of our major issues of concern, which is on the bulk input into the CEDAR, through the CEDAR platform. So we're going to be having a demonstration from them. And then, of course, we'll have Putu give an update on the access and control technical sub-team. And Misha hopefully would have some updates for us on the special issue. Last week, we have about 17 articles that are ready to proceed to the next phase of the editorial for the publication. So hopefully we'll have some further updates today. If I could just share my screen. Yeah, it's not much. It's just for me to have some visuals for everyone. So for today, I would like to give some brief updates on activities of our community. We have commenced some kind of meetings and the initial brainstorming on the activities, on our activities in the implementation countries. So one of our coordinating team, the CORDATE, they are putting us in touch with their teams, their country teams in the 3 countries where we'll be implementing the FMO projects. That is Zimbabwe, Ethiopia, and Uganda. So already we have met with the CORDATE team in Ethiopia. We have exchanged some ideas. We have tried to also kind of explain our work. Like we have been saying during the phase 1, this is new to a lot of people, and we're especially we're in very important position pioneering this in most of the countries in Africa and even actually beyond Africa. For VODAN Africa, our work on the verification of COVID-19 data is novel, and a lot of people are excited to hear about it. And at the same time, it sometimes gets so technical because the idea of data visiting is still very new to a lot of people, even in the scientific and research communities. So Professor Miriam, and then of course, the management team, we have commissioned Obina to produce a kind of CEDAR and of course VODAN for dummies to put in our activities to simplify the technical aspects of our activities and our implementation, to put them in the simplest format so that anyone, and then no matter the level, will be able to have an understanding of the work we are doing. And for the Ethiopian CORDATE team, we have also, because they are already involved in health projects in that country, we have offered to exchange our workflows so that they will see our approach and compare to what they have on the ground, and then we can find some synergy and convergence that will make it easy for us to work in those countries based on what is available. The Board of VODAN Africa have met and taken some administrative decisions. part of which is the issuing of appointment letters to the members of the board, the country representatives on the board. That is completed. Just the letters where the chairman of the board signed off on the letters yesterday. So I'm going to be distributing them before the end of today. And of course, we have been mandated to also express in writing the appreciation of the board to some of our European partners in IPA and the Leiden and Tilburg. That has also been done, and the Vice Chancellor also has signed those letters. I'm going to be distributing them alongside the appointment letters of the members of the board. Last week, Wednesday and Thursday, on the invitation of Google, one of our sponsors, we were invited to make a presentation on our activities. And Rudan, sorry, I just want to check this message whether it's for me. Oh, Dr. Raya does not need permission. I actually removed the waiting room so that everyone can get in.
He seemed to have a problem. I also had something saying that I needed to have permission, but then I could click it away. Anybody, any idea what I should? He's asking me how he gets in. How should I instruct him?
It's just for him, the link. Putu, do you have something to say to that?
Yeah, maybe need to log in first into Zoom, and then she can join the meeting.
Oh, okay. So he needs to log in.
I will make announcement around.
Putu, I will connect you in WhatsApp. Then you can help him there.
Yeah.
Thank you.
I was going to suggest to Aliyah or Putu to log into the VODAN Africa back office and remove that. Don't need login to come in.
Okay, I can do that.
Right. Thank you. So continue, Rudwan, Yunli and I were at the Google COVID-19 Research and Action Workshop. And then I presented on behalf of the VODAN Africa team, our project, the progress we have made so far. And it's so interesting to know that of all the projects that are sponsored by Google and actually their own project themselves, none has been concentrating on providing the kind of data or providing a data source. They have all been sourcing for data elsewhere, but we are actually into data production. So it was something so exciting. And at the workshop, Google also wanted to know what they could do further to kind of help our project. And we made two propositions. One is on the indexing of the fair data points. We just didn't want to index the website or the pages, but we actually want the FDPs to be indexed. And they have been in talks together with Rudan to get connected to someone, a technical person at Google that could actually do the indexing of the FDPs. And then the second request we made was that, which they actually promised to grant immediately, was to make our FDPs official data sources for Google projects. And we're very happy to do that because they're one of our sponsors. And then since we've been able to demonstrate that we are actually publishing in our FDP data that has provenance, and then they are also under the control and ownership of the source countries. So they're happy to, in most of their projects, they will make a presentation of their data sources and say there is nothing from Africa. And we made a case that we have 9 FDPs and we've been working since April of last year to put this together. So now they have an opportunity to have a data source from Africa and then under one of their projects, and they're actually happy with that. You would have received in your emails the first edition of our VODAN Africa newsletter. I got mine, and I would like to thank Obina, who is leading our communication in making this possible. You would also need inputs from you if there are things you want to add, people that will want to contribute, so that we'll keep this up at least monthly for now. If later we have many content, we could decide to split it, but for now we agree last time to have it monthly. So if there are contributions from the country clusters or from individual work experiences within the VODAN Africa community, please feel free to reach out to Obina for your emphasis gathering materials for the next edition of the newsletter. By next week, we'll be having a week today, actually the meeting of the steering committee, the second meeting of the steering committee of VODAN Africa, where critical decisions will be taken on the direction of this project. After the meeting, I'll of course be able to report, for the invite has been sent out, and then we have the requirements specification document, the technical specification document ready. It has been approved by the board, and now we're going to also seek the input and the presentation to the steering committee so that we can formally and officially commence the project in those three implementation countries while we continue to provide support for the three countries. Thank you. I think that is the update from me. I'll be happy to take questions or contributions after we probably have heard from the other members of the team. Thank you. Putu, over to you, and
Yes.
Aliyah.
Thank you, Professor Francisca. After update from Professor Francisca, we will move to the next session. Is Getu or Samson here? Because the next session is about demo about FDP bulk data upload. So Getu or Samson, can you
Hi, Potu.
yeah.
Can you hear me?
Yeah.
Yeah,
Yeah,
good
Samson.
afternoon, everyone. So can I start? Can you enable screen sharing for me?
Oh, wait a minute. Alia or Professor Francisca, can you enable screen sharing from Samson?
Yes. You can go ahead and share now, Samson.
Okay, go ahead.
Let me know when you can see this.
Yes, we can see your screen. I can see your screen.
Okay, thank you very much. I'll try to quickly present what we did. The purpose of the script is to be able to bulk import data or export from other systems into CEDAR. As you can see, for anyone to be able to add data, someone must click populate, and then populate the data here one by one. But imagine if you have a lot of data, it would be difficult for someone to be able to add data to the system. So what our script does is through the CEDAR API, it sends data. Here is a sample template that's here, and there is also, let me also show you the data. I've sample data here, which has 6 records, just for the sake of this demonstration. For this, the first patient is this was a COVID data collected in our site, actually de-identified. So this script, this data, as you can see, the fields here need to be similar to the template, and we have here a place where we bulk upload. What we need to give it is a file location, the token that is used to authenticate who is uploading data to the system. Because when you do it directly, you need to be able to log in, and CEDAR system has a home folder which is provided. So the first one is your data. The others come here from CEDAR. In CEDAR, if you go to CEDAR template, then it gives you the option of when you click on the profile icon, you'll get these things. This is after login. This shows the location or the home folder, and this is a key which helps to identify it's a token. So we need to be able to use this token and then this home URL to be able to send data to the repository. So I'm going to give it my home the location of the file, which is the source file in my desktop, and then I give the token and then my home folder directory. Then when I click submit, it should be able to send the data to the server. If we see here, when I click this icon, it will show me the list of data. So the data is being uploaded at this time, and while it's uploading, you can also see how much it has uploaded. It says it has uploaded the 6 data items which are presented here. The first one is male with age 21 and the likes. And when I go to CEDAR and cross-check the first one with ID 16, I can open and see the data. As you can see, I have a male 16 with nasal something, and then I can be able to see the JSON link data created here based on what is exported, and the RBF is also available here on the system. So what the code basically does is it tries to, or it instead of uploading data one by one, it helps uploading the data in one click. And to be able to do this, we had some webinar with John, and he has shown us how to use this Swagger as the documentation for the CEDAR API, and we used the information here to be able to understand the API of CEDAR. I think CEDAR has a good API and other features. This is, I think, what I have to say. I don't know if I have to record in anything, or if Gatu has something to add. I will give the floor to Gatu. Gatu, over to you.
Thank you, Sami. So the demo was as you followed. The other thing that we need to mention is that the code will be available on the GitHub. Probably Alia, we will contact Alia to give us the address for the GitHub of VODAN. And the other thing that you should understand is that the code has some configurations that you should follow. If you understand how the Swagger works, the Swagger UI, we follow the same approach in our code. So you can follow the way you approach Swagger in our code, and you can create your own form, any form in CEDAR, and by copying the JSON DL, you can upload any data using any form using the code we are going to provide. So if you have any question or any doubts, or you can approach us anytime. So we will make it available in GitHub, and you can try it by yourself. Thank you very much. If you have any question.
Moreover, we will also put documentation on how it can be adapted to other templates. And we're also planning, because we have not been in contact with the team, we've not been able to update it for the new template that's going on. We are planning to adapt it to the new template as well, and we will also provide documentation on how anyone can use the code to be able to upload bulk input to CEDAR. Thank you.
Thanks, Getu and Samson. That's excellent work from Samson and Getu. Is there any question or comment?
Yes, please.
Oh yeah. Please, Oliver, you can ask or comment to this demo.
Okay. Well done, Samson and Getu. You guys have done great work here. But then I have a little comment on the usability of the front end. Yeah, I would, since not everybody that will be using this platform are very conversant with web development, as a matter of fact. So I would suggest you make your form inputs, as in you streamline it a little bit. Not everybody will understand the use of absolute path, because most of your inputs requires absolute path. So I think you should streamline it. Maybe you use a file picker where they have to pick the file from use HTML file picker, or then where you have to use absolute path, you streamline it so that they have little, it's just very little they will have to interact with the system to avoid a lot of confusion and errors. That's just what I think. I don't know if you understand what I'm saying.
Yeah, I understand. It's well taken. You saying the file browser would have been better than just putting the plus. I think it's well taken. Yeah.
Yes.
Shouldn't be. Yeah. Thank you.
Yeah, not everybody will understand the five-part system as in structure. Yeah, some don't understand because people will be using different devices, and the five-part structure differs from device to device. Yeah. Thank you.
Yes, you're right.
Yeah, that's good observation, Oluwele. Actually, not only the file address, but the token and the home address, home folder address of the CEDAR, all when the code will be integrated with the CEDAR code base, that would be that we will for sure we will make it easier for the user to select any folder address. So yeah, good observation. Thank you.
Welcome.
Any other question or comment?
Hello, Samson.
Yeah, go ahead, Abdullah.
Yes, that's
Yes, so I was thinking about the. Hello?
Yes, I can hear you, Abdullahi. Go ahead.
Yes, so I was thinking about the identifier, as in I can see user ID for each of the entries. So I don't know if there won't be conflict in the end, not from the profile, but for each patient records, for instance.
You mean the forms, each form?
Yes, for each form.
Yeah, for each form, it has its own unique address. So what we have done is we just copied the JSON link data from the CEDAR and put it in our program. So for every user, it has its own unique address. Therefore, we have to copy the CEDAR JSON link data, and we have to edit it to our interest. Do you understand what I'm saying?
Yeah, so is there any validation like so that where we wouldn't have duplicate records on CEDAR? That's my point. Is there any validation within the code base?
Yeah, that's one limitation that we have to look at carefully. But for every user, there won't be any duplication. If I understand your question clearly,
Yes,
maybe
yes,
Samson,
yes.
Samson would help me here.
Yes, I think it's a good question. That should be one of possibilities to. It should be possible to validate which ones are already uploaded and which ones are not, because in this case you have the patient ID. If you because API provides the option of gating data, which using GET request, it's possible to validate which one is already uploaded and which one is not. But for now, we only considered being able to upload. Otherwise, it's a good observation. It's well taken.
Hello.
Yeah, Ibrahim Abdullahi uh, want to ask
Yeah.
something, I think. Yeah, go ahead, Ibrahim.
Yeah. Thank you, Putu. Can you hear me, please?
Yeah, I can hear you. Go ahead.
Yes.
All right. I want to ask: do we have the health healthcare professionals amongst us at the moment? Because I remember when we got the COVID patient data, and we got the record with a unique patient ID, but we don't know if it is mapped according to countries, states, or the health facilities. Just a follow up of what Abdullah Hikau asked, so that we don't have duplicates. Take, for instance, if you have a patient's record in Jakarta and another state in Indonesia, how do you differentiate 01 of Jakarta and 01 of maybe Bali or Bandung? Thank you.
Yeah, I think we need to make one thing clear. This script was developed as a proof of concept. I mean, for whether we are able to be able to send bulk data to CEDAR server. It is not meant for we didn't have a defined what I call requirement for that matter that considers all this and other cases. What the purpose of this script was when it was done, the fact that there was a problem from Tunisia side to be able to insert data. They were inserting data one by one to CEDAR, and this was developed in response to the challenge faced there. But going forward, what we are planning to do, at least as per as a discussion with Gateway and me, I think we can enhance this further by defining requirements, and we'll just put the code in the VODAN GitHub, and anyone can contribute to the code, enhance the code, and we'll, as a team, modify the code, and we can proceed further. Otherwise, there aren't much complicated requirements that we have received so far, but going forward, it should be something that we can do as a team. That's what I can say.
Yeah, there
Over
are
to you,
two.
Putu.
Yeah.
Yeah, Ibrahim or will want to comment to the maybe Ibrahim first.
Okay. What just as I asked, I think it's going to be very, very intuitive of Vodana, I would say, to start with. Sorry, I think it will be very interesting, and it will be very intuitive of Vodana to start by uniquely identifying the patient record if it doesn't object to the WHO standard of patient record identification. We can start with the countries that have the active FDPs so that we define what we are putting into the FDPs. Then moving ahead, just as he has suggested, we can formalize it, sort of.
Yes, thank you.
And go ahead, Oluwole. You can.
Okay, thank you. Just like Dr. Ibrahim already said, I was going to ask if there's a standard or a format of assigning patient ID to each of the records. I don't know if there is any.
Thank you, Oluwole. If I Yes, that's we're going to get from the hospitals because from the workflow documents, each patient will have an ID. But then looking at the DHIS that is in use in most of the countries, it's assumed that it's going to be uniform. But like Samson said, we have the problem of bulk inputs, and it seemed like it was something that could not be done. I remember even on the DSW, we had the same problem, and they said it wasn't in the requirement. Give us the API that we're welcome to play around with it if we're able to figure it out. And then for the CEDAR, the same thing. Gatew and Samson were able to figure it out immediately, and then we lost contact with them. So this was just done as a proof of concept. We have not standardized it based on even the overall approved structure of the data entry dashboard or the form. But the fact that it is now possible when you have your data in CSV, no matter how big, you can just import everything at once. That is what we're demonstrating here. We're still going to have to fine tune based on the data entry form that we are working with in the project. Right.
Okay. Okay, yeah, that's okay. I think at the end of the day, we'll need to figure out how the system itself will automatically assign IDs to each of the records. But then that does not negate the fact that patients would have their unique ID from the different hospitals, which is so that means we'll probably be having two identifiers, one for CEDAR, then one for the hospital patient ID from a particular location. Because that's the only way we probably can avoid duplications.
Hello.
I think for this issue, we can add, for instance, like unique ID for each hospital. So, and then when we create like the unique ID for patients, we firstly, for instance, like the enter the unique ID for hospital and then the patient's ID. So then we will not have like the overlapping.
Yes. Yeah, that's correct. I think that's okay.
Okay. I think, okay, there is another question. Elia, go ahead.
Okay, my question is it possible to customize the page to one's need if peradventure what we have a unique one to others and you want to customize to a record you actually have in a particular hospital that actually have some things that are different from what you have existing?
Yeah, yes, it is possible.
Since we want to do a bulk upload.
It's possible. First, you have to create the form in on CEDAR, your own form, and you have to update the JSON link data in the code. So maybe if you know how the Swagger UI works, in the post, the Swagger UI requires the template instant JSON code, JSON script. So it's the same approach we have used. So you first create the form on CEDAR and copy the JSON LD data link script into the code, and it will successfully work. So you can use the code to upload bulk in any case. Maybe we will.
Moreover, I think.
Continue,
yeah,
Sal.
Yeah, what I'm suggesting is, I think for those of you who are interested to see the code and how to customize, maybe we can arrange some time to discuss in detail, and we can also see how the points of enhancement.
Yeah, thanks, Samson and Getu. I think if you have if the others have any questions, maybe can contact Samson or Getu, or maybe we have another session that specifically discuss about this bulk data upload. So now I think we should move to the next session. It's CEDAR update from Mariam and Alia. Maybe one of you can speak about this.
So I can shortly summarize yesterday's meeting. So yesterday we had a very big discussion. So so the main thing is that we are going to have we have the opportunity to go with the CEDAR based FTP. So that's why this is something to consider our end goal and what we want to provide hospitals. So in order to draw the architecture and what we are going to provide them, and what will be the end product, and what our product adds to their, for instance, procedure or data management, wherever. So this is the main thing that we need to work on at this moment. And yesterday we were able to witness the coding on the bulk input of data to CEDAR. So that was the great achievement for us. Yeah, so the main thing yesterday we were discussing with John and had a presentation on vocabulary creation, automated vocabulary creation. So and we discussed the motivation behind of that. Why do we need that vocabularies, and what kind of which kind of principles can be used for vocabulary creation. So, and then in the next session, we will have the implementation part on that so the third part is going to be in the implementation part on that vocabulary creation, where we will deeply go and see what kind of tools can be used. And also yesterday we were able to create the VODAN GitHub account with Mariam, and also publish it vocabulary that we would like to see in BioPortal. So so next time we will, I guess, we will be able to upload that vocabulary in a CEDAR, and we to see how we can use it. So basically that's it from my side. If Mariam, if you want to add, please go ahead.
No, I don't have anything to add.
Okay. Thank you.
Thanks, Alia, for the CEDAR's update. And the next session is update from access control and security. So now I think because Getu is back, so Getu will take over the security part, and I will focus on access and control. So I will share my screen to show the progress. Yes. So because of we are now in the first step of access and control. It's understand the general idea then identify the methodology. So we treat this as architecture because this is architecture. So we treat this as architecture that also should have a principle. So now the principle should like a standard has we should elaborate the principle. What I mean of the principle is the data access and control and also security. So we create the we start to elaborate the principle. For example, for data access and control, so we have a principle regulated data access and control, and we will elaborate this and finalize the statement, the rationale, then and also the implication. So what is the statement? Statement is the principle, the rule itself. So it's like describe what is the principle itself, and also what is the rationale. It is why do we have this rule, and also the implication. What does this rule mean in practice, and what are the consequences? So basically, we elaborate the principle, and the implication is the practice of the principle. For example, like because we want to have regulated data access and control, so we should have education task to ensure that all organizations within the hospital or and clinic understand the authority of access and control. So we should finalize the principle first, uh, and then find the method on the implication, because the implication is the practice, not the best practice, but what we should do after we have this principle. And Getu also will create the principle of the architecture. So I just put the name data is secure, but let's see if we have other other name for the security principle. So basically, we want to finalize this in this month, I think. And then the four answer from the previous question, we will use this answer to answer the implication, to answer what is the best practice. So after we finalize this principle, so we can start to check what is the method to fulfill the implication of this principle. So that's basically our focus right now in data access and control. Getu, do you want to add something?
For the time being, I don't have anything to add, but in regard to the data security principle, we are working on it, and we will fill the table as you feel the data access and control principle. So maybe next week we will update you on that. Thank you.
Yeah, thank you, Getu. So basically, that's the general idea. So because you right now you have the idea of data bulk upload, so we should like connecting each other. I mean, like you should you should consider the integration with FDP, and also we should consider about data access and control, and also the security for your tools. Is there any question or comment?
Yeah, I have a comment. I think all this CEDAR integration to the FDP and the access and control and security all should come together at the end. Therefore, I think once again we have to discuss on the architecture, how we are going to integrate the FDP with the DHIS, for example. So maybe this week or next week we have to think thoroughly on the architecture of DHIS2 and FDP, how they are going to integrate.
Yes, thank you, Getu and Samson. So start from now, if I'm talking about principle, so it's about the architectural principle. So maybe it's like be confusing if I'm not explaining about the architecture principle.
If I can say something, Putu.
Yeah.
We have already discussed the relationship with DHIS, and we cannot, I don't think that we will be able to integrate DHIS because it's a standalone product to which we don't have access. So the architecture, I think Aliyah has the slide of that architecture in which the JSON produced in the production of the metadata is the input for DHIS, and then DHIS goes to its own, well, wherever that goes, to the ministry and elsewhere. And then an output of the repository in the clinic that is produced in the FAIR metadata by us, then will have its clinics dashboard, which here is in data analytics and query possibilities at the clinics level. So yeah, this, I don't know if Getu and Samson have seen this, but the data entry on the CEDAR templates, the CEDAR templates are being prepared by Mariam on the basis of the DHIS entries. The data entry has a bulk input as per the work of Getu and Samson, which then goes to the hospital's data repository and then is transferred into the DHIS to seamlessly assist that process and make sure that there's no duplication at the level of the data input for the clinic. Then the hospital's data repository is published in an in an FTP or in an online publication so that the data repository is reachable. Actually, I don't know if the data analytics shouldn't be in the API prior to the FTP. That is still a question. I think there's still some refinement to do on this architecture.
Yes.
And also, yeah, also on the query across the clinics, which is not yet clear. So that's a number of things, but I think the line from the data entry into the DHIS, that line is probably clear. And then the line below, I think that there are different alternatives possible there. So I'm not completely sure of that line.
Yeah, Professor. The concern is DHIS has its own data entry already being used in many countries. So our concern is there might be reluctance to use CEDAR data entry templates because there are already forms. So we have to consider such reluctance in
the thinking there, Gato, was that we're using the templates of the HIS. So the entries would be the same. So it's really just transferring the data into the HIS. It's not integrating the HIS into the FAIR system. So it is using the input that DHIS has, because DHIS has an input possibility. So you input the data in DHIS, and that is it.
Okay, yeah.
Possibly, can I jump in? One thing I think to add to what has Getu said, DHIS2, there has been a lot of training given to the employees and everything. And coming up with a new system would probably be very challenging in the context of Ethiopia because lots of systems have been tried and people now seem to have adopted DHIS2 because DHIS2 has its own analytics and everything, and it's a matured system. To add some modification in the architecture, even if this architecture works, but there should also be a line from DHIS2 back to CEDAR, for instance, or from DHIS2 to directly to FDP, because DHIS2 has an API which allows for the bulk input that is collected by the health system to be directly transferred to CEDAR if need be, or directly to the FDPs. We might use the CEDAR to convert the data to RDF and other formats. So I think we should be able to allow for some health systems which would like to stick to DHIS2 for collecting data, because at the end of the day, I think what our objective here is not to stick to CEDAR or any other tool. Our objective here is to be able to get data directly to the FDP. So in light of that, we might need to draw an arrow that allows for the bulk data collected from DHIS2 to go to any other data store.
Yeah, Bert,
But
yeah.
Yes, Bert wanted to say something.
Yes, I wanted to say something. I think this is a very important, crucial step in terms of the integration with DHIS. So my recommendation was, should we check this maybe with some of the technical guys that were at the start of the Fair Data Point? For instance, I'm thinking of our friend Luis Bonino or Kees Burger, maybe, to have a small meeting with them, just to go with them over the architecture and say, listen, you know, is this all in line with what you guys are thinking? Is that an idea that we ask them their view on it?
So what I think we need to understand, Samson, is I don't think that the HIS would necessarily bulk input into the FDP. So the thinking is that the production of the data needs to be done prior to the input in DHIS2. And then DHIS2, being a mature analytic system, can do what it does. But the data localization and data analytics at the clinics level is then organized in advance to the data being transferred into DHIS. Is that something that does not make sense to you, Samson?
Yeah, it makes sense. I'm not saying this architecture doesn't work. I'm just thinking of from a duplication of effort perspective, in like when we practically go to the premises and the health ministry, especially in Ethiopia, would be very reluctant to adopt new data collection forms just to tackle that challenge. Otherwise,
Yeah, but
perfectly.
Yeah, but these are not new forms. These are existing forms, isn't it?
Yeah.
But they've just been translated into the CEDAR format, but it's the same forms.
Yes, but Samson has missed that because Samson wasn't there. So Samson, the templates are exactly the same as the DHIS templates. Mariam can speak to that. Maybe Mariam, you want to show that? You could even show it in CEDAR on your screen.
Yeah, okay, so basically the DHIS2 is made up of different forms. Let me just I think I'll need to be my co-host. Okay.
In the meantime, can I speak to save time? My concern is not about the difference in the forms. It's going to be, the data is going to be inserted through CEDAR, no? It's not going to be through DHIS. So a little change, I don't know, in other cultures, a little change in the way they do the health workers is somehow they are change resistant from my experience, because they would, the way they look at it is going to be they've been using DHIS2, now they use CEDAR to collect data. That's the concern. I don't know if it makes sense.
Because actually, usually what they do, they use paper forms to collect the data in the first place. So what we're basically doing, we're digitizing that step so that they avoid having so much paperwork. And so what would basically happen, they would be entering the data through CEDAR and then probably pushing it through the DHIS2. And the forms that we're currently creating in CEDAR are the same forms that I used in the DHIS2 system. I'll just share my screen now. Okay. So these are the different forms that I used within the DHIS2 system. And this was prioritized because it's the it collects data on notifiable diseases, pandemics, and yeah. So this is the templates, as you can see, and it's similar to the form. I'll just these are the forms, and the forms were actually obtained from the different hospitals in Uganda and the Ministry of Health. So we're actually using the same forms that I used within the DHIS2. I don't know if I need to show anything more.
I think that's fine. Thank you.
So this is the form in paper. It was basically scanned. So this is, they enter the data in the paper forms, and then at a certain point within, there's like the monthly reports and the weekly reports and quarterly reports. So every other time they have to enter the data within these forms, and they have a time when they have to enter the data into the DHIS2. But after entering the data into the DHIS2 system, they don't really have access to this data. So they only have it in paper form. So would basically be digitizing the data, and then they would be able to carry out different analytics to the data at hospital level, not just at the Ministry of Health level. Yeah, that's it I have to say. Maybe if you have any more questions.
I wanted to just flag, Mariam, that this, what you were just explaining, I think is really the crux of what we are trying to do. So maybe for Obina, for our communication, this is really very important to explain and why we are doing this. So basically what happens, at least I don't know whether this is the case in Ethiopia, but what Mariam found in Uganda is the input of the data on paper and then directly in DHIS, but then it doesn't come back. It's not a capability within the clinic to analyze those data or to even have them locally available. So I think that is the addition that we make. And it's possible that in the future, I don't know, DHIS3 will take it over, who knows? But that is something that we will see as time goes forward, Samson, that could be a possibility, because it could just be in fact an improvement on the current DHIS architecture.
Yeah, I think it has more to do with the policies and how they treat data and how they store data, rather than with the system, because the system has a hierarchical structure and different hierarchies. People with their accounts have the possibility to see at different numbers, but for different reasons, I think they allow people from, I think, from district levels and above to hierarchically see data. But the good thing about what's been going on with FAIR is to empower the workers at their premises themselves. But I think it will require a little bit of a thinking on how it should be done and what are the challenges, because I tell you, in the context of Ethiopia, the challenge of making people use new tools to collect data would be high. But I think we can figure the best option as we move along. Thank you.
I think it's critical what you just said, and I think it's really probably the most important of what we're trying to do, and what needs to be understood further in order to see how best to go forward in that sense. Yeah, I really, really agree. It's very important discussion.
Thanks, Professor
Thank you.
Miriam. Yeah, but there is a question from Obina. I will read the question. The non-availability of data at local level, is it by design, policy making, or the limitation of the system? Maybe Mariam or Alia?
Well, I don't have to say to this question.
Mariam, can you respond to this question?
Sorry, I lost you for a bit. What was the question?
Yeah, it's on the chat box. It's the non-availability of data at local level. Is it by design? Or... Yeah. Mariam?
It's actually the limitations of the system.
Miriam, are you still there?
Can you hear me?
Yes, I can hear you, Mariam.
I'm not sure if you still have heard it.
Can you hear me?
Yes, I can hear you.
Okay.
Yeah, we
During the interviews, well, what I noticed was that it was actually to do with the limitations of the hospital system, because they collect some of the data, the patient data, but most of the data is actually entered within the paper form. So they do double work. They have to enter the data into the hospital system, which is very limiting, and then afterwards enter they enter the data into the hospital system from the paper forms, and then from still with the same paper forms, they enter the data into the DHIS2. But the systems, the hospital systems are limiting, so they're not able to enter all the data that they collect with these paper forms, because they are provided by the Ministry of Health. So would actually be doing them yeah.
Thanks, Mariam. I think Obina cannot respond due to the network. So is there any question or comment? Okay, Obina respond. Thanks, Maria. I guess there is no question uh, for the CEDAR and FTP integration architecture. So we can move to the last session. It's the update of Fair Special Journal. Is maybe Misha or is Misha here? Or Alia can update about the.
I'm here.
Oh yeah, Dr.
Would
Sakirat,
you?
sorry. You can please go ahead, Dr. Sakirat.
I'm here. Yeah, Aliyah, could you please share the? Yeah, thank you. And well, it's just a very brief report, and also serve to encourage the authors on paper that are still in progress. Next slide, please. Yeah. So all these articles, they are ready, and Professor Miriam have gone through. So we are sending them for review anytime soon. Next slide, please. So and all this too, I'm going to give summary at the end of the slide, and want to say thank you to these authors and their team. Next slide. So during the week, we received 2 new articles titled "The Artificial Intelligence for Qualified Competence Without Comprehensive Sense" by Jetham, and Dr. Reginald also, "Leadership for Collaboration on Value Creation in Commons Across the Globe." Next slide. These articles are being finalized. What we mean by that is we are waiting for the author. Maybe one of the articles, the introduction is missing or is not fully completed. And we call on these lead authors and their team, put through your article titled "Privacy Protection on VODAN Africa Architecture." And one demo. You have 2 articles that you are leading here, just to tidy up some few things there. Then Ibrahim Abdullahi and Kawu Abdullahi, the 2 articles. We wait for you to tidy them up so that we can send them for edit. And Yilin too, thank you so far. We encourage you to finalize this article quickly so that we can send it out for editing. Next slide. Yeah, so we noticed some edits in some of these articles in this week, like launching an international fair data network for COVID data, and regulatory framework and fair compliance with health policy in Ethiopia, led by G2 and also beyond ECRF. Also, the last article, curriculum development for fair data science. We call on all authors that are involved in the curriculum, directly or indirectly, people like Getu, Aliyah, Ezekiel, Akidele, Obina. Please, let's get together and finalize this article and submit for editing. Next slide, please. Yeah, these articles, we couldn't really monitor the progress. We see some having extended abstract of like 3-4 pages. We can see some 2 pages there, and we call on the authors, the potential authors, to look into this article and let us see to completion. And I remember that when we started this, Professor Bingham was advising us that if you see any of the article and you feel that you can write well on the article, you can take it over. So we encourage, because our plan is all the articles that all the titles and abstracts that were accepted. We do not want to lose any of them. We want to see them to publication. Next slide, please. So we are following up on this progress. So the summary of it all is that we have about 11 articles that are ready without any questioning for editing. We received 2 new articles this week. Then we have 6 articles that we need to finalize some things there. Maybe it has to do with the introduction, or maybe the conclusion is missing or is too short, or things like that. Also, 6 articles are okay with edits. We noticed that they have started work on it, so we encourage the authors to do fast, because we have a deadline that we are approaching, and the articles that the progress that we are not so clear about, we encourage the authors to make haste and finalize on this article. Thank you. Thank you. I'm done. Putu, you have the floor.
Yeah.
If there's any question.
Yeah.
Okay. Just wait. I can see in the chat box somebody was writing that Article 20 will be finalized this week. Okay, that's Akindele, Akinka. Yes, thank you. We'll love that. And also the curriculum article, I believe that it will be ready this week. You have the floor, Putu.
Yeah, thank you, Dr. Sakinat. Also, Yulin also update Article 34 will be ready by this Friday as well.
That would be awesome. We'll love that.
Yeah, and I will respond for the Article 32. It's about privacy. So previous week, I discussed with Eric, and I will be the first author, and I just chat Misha about this, and I will finish the article this week to only minor edit, and I will discuss also with Eric about this. So I'll make sure the article will finish this week. Is there any
Article 15 from the ones which you said their progress is unclear is also being edited.
Okay. Well, I'll change the state of something, and that's very awesome. I'll change the status.
Yeah, we are also working on the Article 16. This is Getu.
Yes. Yeah. We still have to finish up the curriculum article,
That's also the, but I'm not sure if I would author for Article 8. My name was, you indicated my name in the Article 8. We were providing comments to Wondumu, I think.
Well, the authors that we copied directly from the drive. So if articles, they nominated themselves. Okay. Now, Professor Miriam, are we clear on all the first authors and corresponding authors? Misha sent me authors. Yeah. What happened is that Misha sent messages to everybody on who should be the lead author, and whether the lead author is also the corresponding author. And then I know that some replied, not everybody. So please, the lead author, we believe, should be the conceptualizer of the article, but the corresponding author will be who will be corresponding, we will be asking questions and making references to anytime we need to question the article. So the lead author could not necessarily be the corresponding author, but the group of authors should appoint somebody to be a corresponding author. So if you have not responded to that mail from the mail Misha sent, please respond. And Professor Miriam, I'm sure that this article that Getu is talking about was not part of the mail Misha sent, because the mail Misha sent were the articles that were submitted and that you have reviewed for editing. So those were the one Misha sent messages to, and this one is not part of it. So if you are corresponding author, please let us know, or Misha, let Misha know so that he can make correction on the Excel sheet. Thank you, ma.
Thanks, Dr. Sakinat, for the update. Is there any question or comment about the FAIR Special Journal?
Maybe Putu, I can just say that I had a correspondence with Susan today, and she's ready to start as of from today. So, just to emphasize what Dr. Sakinat just said, is we cannot take to if we are not clear on the first corresponding author, because then we don't know who is going to pick this up after the editor has done her job. So the message to Misha needs to be answered, and then when also with the final version of the document in Word, because Susan will edit in Word. So we want to know which is the version that is ready for your purposes and that can be sent to the editor. So he has asked for the authors list, the corresponding author, and also the Word document to be sent. So that needs to be done.
Yeah.
Okay, Professor Miriam, I think what we would do again is we send a reminder, because I know Bisha sent that message. The article that I was leading, I'm also the co-author, and I'd responded to him and told him that I'm the corresponding author. And I believe that some other authors too will have done the same. So we'll look into the responses, and those that have not responded, maybe we'll try to remind them that
yes,
we need such information. Thank
you.
you.
I just wanted to explain. Yeah, I just wanted to explain to the colleagues why it's really important. Because if we are not clear what the version is that should be sent to the editor, then we can't send it. And in order to send it, we have to create a link between the editor and the corresponding author, because there are many articles. So otherwise it will become very, very confused, and we'll just have a pile of articles we don't know where to go to. So we want it to be structured and clear. And this is why Misha sent the emails. And so I really beg all of you to respond, put Sakinat in copy so that she also has an overview of what is happening, but so that we have a structured basis for moving forward. Thank you.
Thanks, Professor Miriam. So, do you want to respond, Dr. Sakinat, or it's enough?
No, I'm clear about that. Also, I will contact Misha so that we'll send reminder out. I'm clear about it.
Okay. Oh, so I guess no question anymore. So thank you, everyone. As always, the video recording of the webinar will be available this week in every channels, in websites like OSF and WhatsApp group. Thanks again for joining us, and we will see you next week.
Putu, as usual, and the YouTube channel, please.
Yeah, in the YouTube channel. Sure. Okay, bye everyone.
Bye.
Bye-bye.
Bye
Everyone. Bye.
Bye, everyone.
Bye, everyone.
Bye.
Goodbye. Have a nice day.
Bye, everyone.